Alors, je suis très heureux de parler
I'm very happy to be able to talk about around the world in medical cannabis. All the speakers will be online. During my career, I've worked a lot to try and promote this treatment. It's true that I worked with Bernard Kouchner, the minister, and I was in charge of addictions several times. And to us, it seemed obvious that this treatment had to become accessible in France very quickly. But when you talk about substances, illicit, illegal substances, you need time. Most of the time for moral reasons, but it took us 20 years. We had to wait for 20 years, very long time, to use a medication that has a most efficient action on a number of pains. Well, I'm talking about pain. I'm talking about alleviating people's pain with a treatment that is accessible, that is simple, that has been experimented in numerous countries. So it took time. Luckily, we now have an ongoing experiment thanks to Nicolas Autier, and I recommend this small document which is called Therapeutical Cannabis, Medical Cannabis, that just came out and shows how this experimentation is taking place. Nowadays, we have 1,000 patients in the trials, so I hope we can use medical cannabis in France very soon. I'm going to give the floor to Professor Mehdi Paes, who he is Moroccan. We know him well. He's made presentations in several of our congresses and symposia, and he's going to tell us about Morocco on the road to medical cannabis. And I will give the floor to Professor Paes for 15 minutes, sir. Thank you, Mr. Chairman. And first of all, I'd like to thank the organizers of this most important meeting, especially my friend, Professor Benjamin, for inviting me to share with you a few elements about this initiative that just happened in Morocco, meaning the legalization of medical use of cannabis. I thought I had more time than 15 minutes, so I'll try to speak faster, says the speaker. Next slide. Okay, I'm going to try, first of all, to present this law, 1321, the reasons that have led to this law, a few words about the regulation activities, the use of this medical cannabis, and the assessment, the trends of use in drugs in the world, the assessment of the experience of legalization in other countries, and the support measures and prerequisites for this legalization in Morocco. There's an issue about production of cannabis in Morocco, and that the Moroccan authorities really have the political will to control and, in a way, eradicate the culture of cannabis, which is a major issue because there's a socio-economic aspect which is most important. Several trials have been made in the past to reduce this culture and to change the cultures for the farmers, but it hasn't worked, and it involves a lot of populations. This is the region in the north of Morocco where cannabis is cultivated, but next slide, please. Okay.
À titre anecdotique,
this is oh well, it was the previous slide. It was 3 bars in Tangier that were very well known in the 50s and 60s because international personalities would come and smoke cannabis, and you also had the traditional Moroccan smoker, but at the time cannabis was not much used. This is the law that was published in July to legalize the use of medical cannabis. Next. So the reasons that led to this law.
Les autorités relevant du ministère de l'Intérieur, pas de la Santé. Alors, l'objectif principal,
health issues, but also the main objective is to regulate the cultivation of cannabis and to control the plants better, because there's, first of all, the issue of fighting against organized crime. There's better control, to get rid of the relationship between hard drugs and cannabis, to improve the life of the small farmers, to invest in the region, and also to introduce a major prevention policy. Next slide.
Alors, les 3 points importants de cette loi, c'est la création.
Important point of this law was the creation of the national agency to regulate the activities linked to cannabis and to promote the use of cannabis only for medical, pharmaceutical, and industrial uses, and to forbid the leisure or recreational use of cannabis.
Alors, ça, c'est le prérogative.
Here you have the main mandate of the national agency, which is to control everything from import, export, marketing, culture, sale, everything that concerns the various steps, whether you talk about production, transformation, processing, or sale. Next slide, please.
Diapo suivante, s'il vous plaît.
Next slide.
Alors, ça, c'est la recommandation proposée.
This is the recommendation of the Social and Environmental and Economic Council that has been advising the government. One of the main points is this need to offer a replacement or an alternative to traditional cannabis growers, so that this population does have
mettre en place de filières de production,
means of livelihood, and at the same time to develop a national economy for medical cannabis, cosmetic cannabis, and to introduce the right control and research about this.
La suivante.
Next, please.
Voilà. Alors,
that's it.
Cette loi a été précédée par.
This is the law that was introduced in 2013. 2 parties, Istiklal and PAM, presented this draft project. But as you know, there's been a change in the status of cannabis as far as the international control protocol is concerned, and on 2nd December 2020 in Vienna, they made this decision, and Morocco followed suit to legalize the use of medical cannabis. Nowadays, as you can see, Morocco would like to solve this issue of traditional culture of cannabis in Morocco and also comply with the international trend. Next slide, please.
à la légalisation.
As you can see, there's a major trend to legalization. In the US, it's legal in almost all states. You have only very few states who have not legalized the use of cannabis for medical purpose or recreational use. Next, please.
Voilà. On voit
So,
tendance au Mexique.
Same trend in Mexico, in Spain.
Procéder à la légalisation.
They're going to probably legalize cannabis for recreational use, maybe.
Diapo suivante, s'il vous plaît.
Next slide.
Le cannabis dans le monde.
This is cannabis in the world, cannabis use around the world. It's the most consumed drug at global level. Next.
Par contre, on trouve plusieurs pays en Amérique latine.
But you have several Latin American countries or Oceanian countries and European countries that have legalized it. In Africa, it's mainly in Southern Africa and also Morocco in the north, but that's the only one. Next.
Alors, quels sont les défis? Moi, je vois que le temps
the
limité,
challenges?
donc
Well, we have limited time.
Concentrer surtout sur les défis, sur les conclusions, parce que.
So I'm going to focus on the challenges and the conclusions. I thought I would have more time available. Now, the main issue is how to convince the farmers, the growers,
Très précaire,
those who live in a precarious situation, and we need to win them over. We also have to find viable economic alternatives. Now, that's not easy. We need to control illegal trafficking and also conduct checks to make sure that medical use is not an encouragement for people to use it for recreative purposes, especially the younger populations, making sure that people don't stop perceiving the risks, because cannabis can be at the origin of a number of issues, and making sure that younger populations are not attracted by the use of cannabis for recreational purposes, and facing the increase of mental diseases that goes with occasional use of cannabis, the increase in number of traffic accidents, economic fallout, and economic expenses, and limited financial and human resources. Countries that have gone towards legalizing cannabis for medical use or as a creative drug, before they implement the law, have had to work upstream to provide a framework to make sure that it is possible to legalize cannabis without too many issues. Otherwise, we are facing huge issues. Next.
Alors, cette initiative qui s'inscrit, cette décision qui a été faite par
the decision that was taken by the Moroccan authorities,
préconisant la légalité,
matching the current trends to legalize cannabis, could be an interesting move.
particulier, c'est que nous observons
But
ces tendances surtout dans le pays.
We have observed this in countries with a liberal economy, in countries such in other northern African countries or Asian countries.
Un pays, par exemple, l'Asie qui a légalisé, que ce soit.
There are very few countries that have legalized cannabis, both for medical or recreative use.
Il est clair que le tétrahydrocannabinol et le cannabidiol sont des molécules très prometteuses dans le traitement.
THC and CBD are promising molecules for the treatment of a number of diseases, but we still need to conduct more studies.
Actuellement, ne sont pas toujours.
And the existing studies are not conclusive. The legalization of cannabis for medical use could be a starting point to legalize the use of cannabis for recreational purposes. And there are complex issues, no easy solutions, and no one-size-fits-all solutions. Every country needs to assess the situation, the possibilities, and put public health policies ahead of everything else. Before everything else. One more slide. Of course, legalizing cannabis,
l'usage médical,
although it's only for medical purposes, represents a big challenge and a difficult project for the national agency in charge of regulating cannabis use. However, it is a good occasion, a good opportunity to exert better control on cannabis cultivation, in decreasing illicit trafficking and improving growers' revenues. So facing the need is not always easy. It's not always possible, especially when you have many challenges. But I believe it's better to face the problems and try to solve them rather than trying to go around or pretend they're not there. We need absolutely to set up a number of provisions and measures before we start implementing the law, and even after we have implemented it. There are countries that already have legalized cannabis for medical and recreational use, but before they did that, they had a lot of work. For instance, in Canada or in the US, the number of cannabis users in the younger populations has not increased. Actually, it has decreased. And if you use cannabis once you're over 18, the effects are far less than what happens if cannabis is used by teenagers. Because if cannabis is being used during the brain and psychoaffective development of a teenager, it may leave irreversible damage, which is not the case if cannabis is being used at an adult age. Now, this is a very positive initiative, and it may lead to many positive fallouts. For sanitary issues, public health policy, economic, but we have to take in consideration the fact that financial infrastructural resources are not sufficient in Morocco to face the consequences of recreative cannabis use. And for medical use, we still have an effort to make, although it may be possible. I'm going to stop. Thank you very much. Thank you. Thank you very, very much. And during the discussion, we will be able to talk about a number of aspects that I had to fly over and could not go really into. Thank you very, very much, Mehdi Paes.
Merci infiniment. Je pense que cette nouvelle loi marocaine est très importante.
I believe this new Moroccan law is very, very important. I know that you participated and that you feel directly involved. We in Europe are also very interested, as you probably know. Large quantities of cannabis come from Morocco and are being consumed illegally in France with no monitoring, no control. And we find it absolutely fascinating to see how the Moroccan government, with the help of this law on the use of cannabis for medical purposes, will be able to put a framework on the way cannabis is used. I know that cannabis culture and crops are very important in Morocco. It's been grown there for ages, and we don't want to change the way it's being grown. We don't want to change the situation for the growers. But we have to encourage this new trend because it's extremely interesting and useful. Now, if there are any questions for both speakers, we will take them. Otherwise, we will move on to the next speaker. Would anyone like to ask a question to Mehdi Paes?
Non, pas pour l'instant.
Not now. Not now. Okay, we'll keep the questions for the end.
Je passe donc
I would like to give the floor now to
à Madame Patricia Conrod.
Patricia Conrod,
de
She's going to tell
Montréal,
us to speak from Montreal,
l'expérience du cannabis
where
thérapeutique
the experience of therapeutic cannabis now dates back to a number of years, because Canada is now legalizing recreational use of cannabis. We are in a completely different position, but she's going to share with us the Montreal experience. You have the floor.
It's a pleasure to be here. And I'll be talking a little bit about the Canadian experience. We're now 3 years on from a legalization policy in Canada. And I'll also talk about some of the more experimental research that I've been doing on cannabis and young people, the mental health of young people. Next slide, please. So, as we know, there have been increasing liberal views towards cannabis use in adults, which have directly influenced increasing liberal attitudes towards young people. And that has been shown to be associated with increases in youth cannabis use in the United States. There are concerns around the time when Canada decided to move towards legalization of cannabis. There were already very clear research demonstrating that early onset cannabis use was a risk factor for frequent and problematic cannabis use and transition to addiction. And so there were concerns, very, very significant concerns, that the increasing liberal attitudes that go along with legalizing cannabis in a society would translate to increased use in young people. It was already recognized that 1 in 10 high school seniors in the United States and Canada reported daily cannabis use. And there were also very, very robust literature linking early onset cannabis use to psychosis. Nevertheless, one of the primary reasons for, or justifications for, legalizing cannabis in Canada and implementing the Cannabis Act in 2018 was to keep drugs out of the hands of young people, take profits away from criminals, and to protect public health. Next slide. So, leading up to the Cannabis Act in Canada, there were some data that came out of the, I think it's called the Rocky Mountain Report. And this was following some really important indicators of the impact of commercialization and legalization of cannabis in Colorado relative to the national average in the United States. And what was observed was this very, very same effect, is that as a society transitions towards legalization through their more liberal views about cannabis and illicit substances, that more young people also take on those liberal views and start to use. Well, what do we know about 3 years on from the Cannabis Act in Canada? We have seen an increase in cannabis use, similar to the US experience. And we have not seen a decrease in youth substance use. It's not clear if we've seen a huge increase in underage cannabis use, however. Nevertheless, retail sales in 2020 were just over 2.6 billion, which represented a 120% increase compared to the previous year. So every year there are indications that there's more and more cannabis use happening in Canada. Next slide. So another concern that I had from the Colorado report was about some unintended consequences of the legalization laws on young people for whom cannabis would remain illegal. So we were subjecting young people to the laws that we had found harmful for adults. And there was an indication, for example, that young people would be even more criminalized as a result of legalization for adults. And often what you heard as Colorado transition to legalization is that, yes, we would allow adults to use, but we're really going to crack down on underage users. And what they actually saw was an increase in total referrals to law enforcement for young underage users or young people. And so what do we know about the Canadian experience? Well, and has it been successful with respect to protecting young people and keeping them out of the criminal justice system? Well, there is an indication in Canada that we're not seeing these similar trends. So there are actually decreases in youth-related offenses or youth cannabis-related offenses. And there is no indication that there have been more traffic-related violations or accidents. However, there have been few pardons for previous cannabis-related offenses, very, very few. And we are seeing that there has been an increase in boys under the age of 15 showing significant increase in cannabis-related ER visits. And young people continue to get their cannabis from illegal sources. And the last thing to mention in Canada is that there is some indication that, yes, the cannabis that people are using, legal cannabis, has fewer parasites and toxins than street cannabis, but the quality of street cannabis isn't as negative as many people had suggested it was prior to legalization. Nevertheless, there was a significant difference between the products. Next slide, please. So should we be concerned about adolescent substance use? Are some substances more harmful than others? And is cannabis more harmful than other substances? Are there meaningful effects on brain development? What are the mental health consequences for young people? And are some people more susceptible to the harm from cannabis? And how can it be prevented? These are all questions that we're asking ourselves in Canada as ways to address the potential impact of cannabis on young people. Next slide, please. And this is a trial that I started in 2012, way before legalization. So I will be presenting data on young people in a non-legalization context. This is a trial that involved 32 public schools in the Greater Montreal area, in which we randomized young people schools to deliver a preventative intervention or not, and I'll tell you more about that. But this trial has also ended up being extremely useful because it allowed us to follow a very large sample of 4,000 young people every year over the course of 5 years during their secondary education experience, in which we not only assess their substance use and mental health, but we also assess their cognitive functioning from the school using computerized neuropsychological battery. And if you could just press the slide, please. We also added a neuroimaging component to this cohort study. So a subset of young people also participated in multiple neuroimaging assessments. So the Coventure sample is really quite an interesting sample because it's not only very large, involving 3,800 seventh graders at recruitment, but it's also an epidemiologically representative sample in the sense that the sample represents about 15% of all schools in all school districts in the Greater Montreal area. And by surveying the entire grade of seventh graders, we were able to recruit and survey about 76% of all seventh graders in these schools. And the public system in Montreal, and it also included a certain percentage of private schools. So across all of these schools, there's an inclusion policy, a very liberal inclusion policy. So there was a very diverse population. To the extent that we included somewhere between 6 and 11% of the entire population of seventh graders in the Greater Montreal area, and represented all of the school districts and all districts from a socioeconomic and a size perspective. If you can go to the next slide, please. It's also worth mentioning there were no exclusion criteria for involvement in the study. So One way in which public health determines the abuse potential of substances, and this is actually still in practice today, is to simply measure the percentage of people who've been exposed to a drug who go on to develop a dependence on it or and controlled use of it. And so we applied that logic to the data in our adolescent sample. And what was really fascinating here is cannabis, relative to a drug like alcohol, which is down at the bottom, ranks much higher in terms of the number of young people who've ever tried it who go on to use it 3 times or more per week. And it ranks up with, some substances like heroin and tobacco, which was really surprising to me. But when you think of it, it's very rare for an adolescent to drink alcohol more than 3 times per week. And if you go to the next slide, if you use a slightly different set of criteria, which would be having a substance use disorder, which means that you would, take risks and experience problems and so on, cannabis then ranks lower relative to many other substances, but nevertheless shows a significantly more problematic substance misuse profile relative to alcohol. And that's exactly what we're seeing and hearing from young people. Again, it's very common to have about 1 in 10 high school students reporting that they're using cannabis daily. And that is not the case for alcohol. It's very rarely the case for alcohol. So in one sense, cannabis is a little more problematic for young people than alcohol is, despite the fact that alcohol does have a very important abuse and public health profile for young people. So I mentioned that this sample also included a number of neuropsychological measures. And what was really, I think, really successful about this study was that we were able to get measures of perceptual reasoning or nonverbal IQ, spatial working memory, delayed recall memory, as well as measures of inhibitory control. Next slide, please. And using this repeated measure design, we are able to use an advanced computational method to begin to start to, if you can just press and allow for a few more features on this slide to appear, please. What we did was use an advanced, please press the button so that you can move forward in the features of this slide, please. Thank you. So what you see is that we used, and do that like 2 more times, please. What you see is that we were able to model a number of different ways in which substance use, sub, and cognition, cog, are related to each other. Press again, please. And what we're modeling here are 3 different types of relationships. So in one sense, common vulnerability, where we're looking at the relationship between someone's mean level of substance use, in this case, maybe cannabis or alcohol, and their mean level of cognitive functioning on a particular task, so let's say general IQ or inhibitory control. And while you're including that relationship at the between-person level, we're also modeling the time-dependent relationships between substance use and cognition. So in a given year, over and above that common vulnerability, would increase in substance use, for example, in year 2, relative to someone's mean level of use, predict an increase in their, or a decrease in their cognitive functioning in that same year. And inherent in that model is if in year 3 their substance use returns to their mean level of use, their cognitive functioning will necessarily return to their mean level of cognitive functioning. And that's what we modeled as a neuroplasticity effect. So your cognition moves with your substance use, but can return to your mean level of use if you stop using. Whereas a neurotoxicity effect was that substance use increased in a particular year, and we observed lasting effects on cognition in subsequent years. And if you move forward to the next slide, what you see is that there were Interestingly, most of the effects of alcohol on cognition were at the between-person
I'm sorry,
level.
but
So
you have
likely
just a
related
few
to
minutes left.
likely related to a
You have
okay,
just
likely
a few
related,
minutes left.
okay, likely related to a common vulnerability, and what we showed was that on working memory and inhibitory control functions, there was evidence of this lasting effect on cognition over and above any kind of common vulnerability, and that was not observed for alcohol in young people. Move forward, please. And these data, I think, parallel some of the findings that we are reporting from the Enigma consortium, which is pooling data of neuroimaging studies on various substance use outcomes. So essentially, we're pooling studies of cannabis-dependent patients or participants relative to controls. And if you move to the next slide, what we find here is that in adults, please move to the next slide, please. In adults, if you compare, what's really interesting about Enigma is that there are multiple working groups who are focusing on major depression, MDD, bipolar disorder, BD, schizophrenia, ADHD, and my working group on addiction focused on alcohol and cannabis use disorders. So what's interesting is that in adults, when they begin to start drinking much more heavily than adolescents and more frequently, in blue you see very significant neurocognitive impact of alcohol dependence. And that what was really surprising here is when we use the same methodology in subcortical regions of the brain, the effects of alcohol on the brain are equivalent to some of the effects that you see in schizophrenia, but not all, but most definitely and more significantly, not more significantly, equivalently in the hippocampus, in the amygdala, and the accumbens. With respect to the effects of cannabis, in green, what you're seeing is that you're seeing kind of two effects. In the hippocampus and the amygdala, and maybe the accumbens, the effects of cannabis are observable. The error bars are very large, though, so our studies on cannabis and the brain are still quite messy and heterogeneous. But there are also some effects that parallels the schizophrenia effects, where schizophrenia differs from some of the other mental disorders in the putamen and the pallidum. So there's definitely more work to be done here. Next slide, please. And so I'll just wrap this up with some concerns about some other public health concerns on cannabis and what we've learned in the last couple of years. As we know, there's a strong link between cannabis exposure and psychosis proneness. Many people in the public health field are quite convinced that there's a causal relationship. However, many people in the industry and strong advocates for cannabis legalization like to understand this relationship as being related to some kind of common vulnerability. If we move forward really quickly, I'm going to present some data to enlighten this debate. Move forward, please. All right. So using the CoVenture data set and using the same approach to testing hypotheses about causality using observational data, in establishing temporal precedence. This is a cross-like panel model with a random intercept accounting for common vulnerability, and that's the relationship between cannabis and psychosis proneness. And what we see
we
is
will
that
have to go to the conclusion. Excuse us, but your next speaker is waiting. So we have a few minutes for the conclusion. Thank you. I'm sorry.
All right. Well, the conclusion to this study was that over 3 repeated cross-lag time periods, so from 13 years of age to 14, 14 to 15, 15 to 16, what we found was that cannabis predicted subsequent symptoms and psychosis in the general population. And only at later stages of adolescence did psychosis symptoms then start to predict cannabis use. But the stronger evidence was in favor of a temporal precedence, cannabis to psychosis. I guess I'll just stop here, where we're now doing quite a bit of work to follow young people who are experiencing psychotic-like symptoms. And we're following them up over 10 and 15-year periods, doing neuroimaging to better understand, multimodal imaging to better understand how it is that cannabis is causing these low prevalence, but nevertheless very significant and problematic increasing trajectories of psychotic-like experiences in young people. The mechanisms by which this is happening are still not very well understood. But one idea and some of the data that we're showing is that it is through this impact on inhibitory control. So through some of the effects that I told you about recently or previously in terms of impacting on some key neuropsychological functions that are implicated in inhibitory control. I apologize. I think my talk was supposed to be 35 minutes, and so I had quite a few more experiences and studies to tell you about, but you'll have to invite me back in order to hear about them. Thank you for your interest and your time.
Thank you very much for your talk, which was very interesting. It's for us very important to know the relation between the neurological effects on children who use cannabis. We will certainly go and see your work so we can have a good look at this study. Now I will pass the floor for Medicinal Cannabis in Australia, a story of fast but partial success by John Ryan.
Thank you very much. And thank you very much for the invitation to speak. I'm sorry I can't speak French. That's my ignorance, but I'm very pleased to be here. It's 10 p.m. In Melbourne, so it's night time. That gives you a sense of how far away we are. Next slide, please. We really are on the other side of the world. Next slide. I just should say that Pennington Institute is an independent organisation, non-political, non-partisan. Our focus is mostly in Australia on psychoactive substances, starting off with particularly illicit substances, but we shifted into pharmaceutical misuse issues because of the increase in pharmaceutical misuse, and we're now undertaking quite a significant study in relation to cannabis, particularly illicit cannabis and medicinal cannabis in Australia, which we expect to release later next year. Our focus is mostly Australian. Next slide. Our international effort is only in relation to overdose issues, and particularly we host International Overdose Awareness Day, which is our attempt to build a community of people who are interested to do more prevention of overdose and to really reduce the stigma in relation to overdose issues, particularly for families who've lost loved ones to overdose. Next slide. It's on August the 31st every year. Next slide. And it's a significant activity in the United States and Canada, actually, because of the toll of overdose in those jurisdictions. Next slide, please. Back to Australia, I'm conscious of the time allocation and how complex the Australian political system is, so I'm not going to try and explain it other than to say that it's really honestly quite messy. We've got a national government and 6 states and 2 territories. The division of responsibility between those levels of government is very complex in the healthcare sector. So the state governments fund hospitals, particularly fund drug treatment, and in the illicit drug space, they also fund the prison system. The national government's really responsible for general practitioners, so primary care practitioners subsidies, paying for medications through the pharmaceutical benefits scheme, and sometimes supporting the states with block grants to run parts of the system. So we have a very fractured system that is honestly quite poorly integrated. Next slide, please. Cannabis was completely illegal until 2016 when there were changes at the national level, and those changes have flowed through to the state and territory levels. And so we've now got medicinal cannabis access in all Australian jurisdictions. Next slide, please. In relation to illicit cannabis, we've got a very complex system as well. It's different in each state and territory. The little territory, which is the Australian Capital Territory, which is where Canberra is, on the eastern part of the country between Sydney and Melbourne, or between New South Wales and Victoria, they've actually effectively decriminalised cannabis, and you can grow 2 plants without any problem. The only complexity is that it's still illegal to buy the seeds. It's illegal to use artificial light, so you've got to grow it basically outside. And the problem in Canberra in the ACT is that it's not very good growing conditions. It's a very cold city, particularly in winter. In summer, it's still a problem for people growing, but nonetheless, it just shows how diverse the Australian approach to illicit cannabis is. Next slide, please. I just wanted to briefly mention that the medicinal cannabis is now mostly accessed through the Special Access Scheme, which is very unusual considering the scale of the medicinal cannabis market in Australia. The Special Access Scheme was really invented for as a result of the activists fighting for quick access to drugs in the HIV/AIDS epidemic early days. There was, in their view, much too careful and slow processes in terms of reviewing the evidence for the efficacy of medicines. They wanted it much quicker because people were dying. And so a special access scheme was invented. It really doesn't fit comfortably into the rest of the way that the Australian pharmaceutical goods are treated. It was for a very small part, a very small number of the population, but it's now being used for medicinal cannabis, which gives particularly some doctors a great level of anxiety about the risk to evidence-based medicine. Nonetheless, it's an effective way of overcoming some of the bureaucratic and process challenges that we're facing medicinal cannabis. Next slide, please. The growth in medicinal cannabis in Australia has been really quite significant. So we've seen 90,000 active patients by the end of 2021. The interesting thing, I think, is the numbers are increasing exponentially. So September last year, for the month of September last year and the month of September this year, the numbers have doubled. So we're seeing an increasing number of patients accessing medicinal cannabis. The projection at the moment is that there'll be 670,000 by 2030, remembering that the Australian population is only 25 million. So it's an undeniably massive growth industry. Next slide, please. Access options are actually quite diverse. You must get a prescription from a doctor, but there's really very little limitation about what sort of conditions it can be prescribed for, and chronic pain is now the leading condition, which is interesting because there's been so much controversy in Australia around chronic pain management and particularly the opioid epidemic and the overdose epidemic in Australia. So there's quite a shift to cannabis as a way of treating chronic pain. Next slide, please. Part of the problem is the cost in the illicit area. It's not subsidised, in the pharmaceutical area, the medicine is not subsidised by government, unlike many other medications, in which case consumers are paying quite a lot to actually become registered as recipients of medicinal cannabis, sometimes hundreds of dollars for a consultation to the doctor just to get onto the program, and then the cost of medication is on top of that. So in a way, it's for people that are socioeconomically advantaged. Therefore, the estimate is that 97% of the medicinal cannabis market is actually still being accessed illegally. So people are self-medicating with illicit supply. Next slide, please. This is really about the other side, I guess, which is about the production capacity in Australia. Part of the political reason, I think, for changing the classification of cannabis to include medicinal cannabis, not just criminal cannabis, was the potential for industry, the potential for tax, and the potential for exports. We've now got a significant number of players in this field, and the suggestion is that it's going to be a major export market opportunity. The capacity that's being predicted through production is significantly higher than the capacity that's required for the domestic market. So I think there are a lot of entrepreneurs that are interested to find export market opportunities. Next slide, please. That being the case, nonetheless, we've got still a mostly imported medicinal cannabis market in Australia. The production capacity is still not up to it. People are finding it more convenient to access products from overseas. So this is likely to change in the coming years, but we are certainly in a period since 2016 of rapid change, including, next slide please, including in public perceptions. The change in the last 20 years has been extraordinary in relation to cannabis in Australia. Nothing compared to what's happened in the United States, but it's fair to say that Australia is often, as an Anglophone country, probably about 10 years behind the United States in some of these sort of cultural moments. We don't have any sense of a political opportunity in Australia for legalised cannabis, but most people think it will come probably in the next 10 years. The support in the community for medicinal cannabis has been very high, and it's come from across the political spectrum. The advocacy for medicinal cannabis was mostly not drug and alcohol sector or addiction medicine specialist advocacy. It wasn't actually medicos doing that advocacy. It was mostly parents of children with epilepsy and other family members and members of the community who were appealing to their local politicians to provide access to medicinal cannabis. It's an interesting achievement, I think, of community-based advocacy rather than, I guess, expert-based advocacy. There are still significant issues, though, for medicinal cannabis in Australia. One of them, next slide, please. One of them is the diverse perspectives of medical practitioners. We've seen, I think, a fairly vigorous debate amongst doctors around whether or not this is a breach of evidence-based medicine, whether the way that the products were registered through the special access scheme was appropriate, and whether, that's leading to a lot of doctors really not wanting to prescribe. And so it's become, I guess, a fairly niche field, because many of the doctors are really quite nervous about prescribing, and part of that, I think, is their own acknowledged lack of knowledge about medicinal cannabis. They're also concerned increasingly now about benzodiazepine and opioid use issues through prescription, and so cannabis is actually being sort of mixed in with the negative experiences that have come as a result of very significantly increased prescribing of opioids and benzodiazepines in the last 25 years. And really, another concern is that medicinal cannabis is just providing access for illegal cannabis users to find a sort of illicit method of supply. And so there is quite a level of discomfort, I think, amongst many medical professionals about, the way that the community was able to pressure the government into providing medicinal cannabis, and then how it's been structured within that. Next slide, please. Part of the other, probably next slide, please. Part of the other challenges is in relation to particularly road safety. There's a lot of drug testing in Australia for people that are driving, alcohol and drug testing. THC testing is basically zero tolerance approach, whether you've got a medical prescription for your cannabis use or not. So it's quite unlike opioids, where you can continue to drive. If you're detected with THC, you lose your license. So there's a lot of people that are not able to access what they believe to be an appropriate medicine of cannabis because it disrupts their capacity to travel to work, etc. It's also very expensive compared to the illicit cannabis. And as mentioned, some of the fees that are being charged just to become to get a prescription are very, very high, in the hundreds of dollars. Next slide, please. So part of that challenge is the continued reliance on the illicit market, which from the commercial market or the legal market, they see the illicit market as a threat to their capacity to run a good business. They're being basically undercut by the illegal market. And as we all know, the illegal market has no quality control mechanisms. The quality manufacturing processes for the illicit market is one of its great strengths in Australia. They're very tightly controlled in terms of production. That makes it more expensive, and that makes them uncompetitive with the illicit market. Next slide. As I mentioned, the perceptions are evolving and mostly towards a positive view of medicinal cannabis, and perceptions are changing around the criminalisation of cannabis as well. There is a growing community of people who are not supportive of the traditional Australian approach to cannabis. But there certainly is, I think, a lot more research, and the previous speaker's presentation, I think, was very interesting in that regard. As we'll find in the years to come, next slide, please, the likelihood is, I guess this is a little bit of prediction, which is that the medicinal cannabis market is certainly in its infancy, but it's grown rapidly in the last half of a decade. The domestic demand is increasing dramatically. They expect, from an industry perspective, to also have it as a significant export market. There are significant issues with the way that it's regulated, both from a evidence-based medicine perspective, but also from a patient access perspective, which is not consistent with Australia's public health approach to medicines, which is that we've basically got a government subsidised access to medication and healthcare in Australia. That's not the case with cannabis because it's part of that special access scheme. If I was very brave, which I'm not, I would think that there's a strong likelihood that the changes that have happened in the Australian Capital Territory in a very small jurisdiction, but it is where the Australian Parliament is housed, those changes are likely to continue in other jurisdictions in Australia when the conditions are right, and I don't think the conditions are right yet. So, in real summary, the cannabis market, both medicinal and illicit, is changing very rapidly in Australia, and I expect it will continue to do so for the years ahead. Thanks again for the invitation to speak.
Thank you for this presentation. We will certainly have a lot to learn from your first experiences as we will start soon. I have to stop the presentation now because we are out of time. Thank you very much to all you speakers and have a good day.